Hello, welcome back to the channel. If you're new here, hit that subscribe button so you don't miss real news that matters to South Africans. Today's news is something you need to hear. Stay tuned till the end to check the sources and verify the facts for yourself. Gauteng's health MEC, Nomantoko Hoko, has called on South Africans to stop the xenophobia happening in public health facilities. Her message is simple but powerful. Even illegal immigrants pay for health services in this country, and we can't keep turning them away from care. This follows growing concerns that some clinics and hospitals are refusing to treat undocumented foreigners, especially pregnant women and the seriously ill. The MEC spoke out during a recent interview and said it's unacceptable and heartbreaking to see people being denied care because of their status. According to her, this behavior is not only unconstitutional, it's inhumane. She mentioned specific incidents where women in labor were allegedly turned away at facility gates. She asked, "What will I say if a pregnant woman dies at the gate because we refuse to treat her?" That question alone says everything. Whether someone is documented or not, life still matters. And our constitution backs that up. Nomantoko also addressed the misconception that foreigners, especially those undocumented, are getting free services while South Africans foot the bill. She said clearly, foreigners, legal or not, do pay for health care. Many of them are billed like everyone else, and some are supported by their embassies. The belief that they're getting special treatment or draining the system without contributing is just false. The National Health Department echoed her statements and said there's no excuse for turning patients away. They reminded everyone that Section 27 of the Constitution guarantees access to health care for all, including foreigners, especially in emergencies. That's the law. And vigilante behavior from groups trying to police who should or shouldn't get treated is totally out of order. This isn't just the Gauteng problem. In places like KwaZulu-Natal, there have been similar incidents reported, where local activist groups have tried to block immigrants from using public clinics. But government officials are saying that this kind of behavior only spreads fear and discrimination, and it puts lives at risk. Let's be honest. South Africa has many challenges in the health sector. But blaming it all on foreigners is not the solution. Yes, the system is stretched. Yes, we need more resources. But we can't start choosing who deserves help based on nationality. That's not who we are as a country. Nomantoko Hoko made it clear that healthcare workers should focus on saving lives, not checking passports at the door. She said if someone is sick, especially in an emergency, the priority must be treatment, papers or no papers. After all, doctors and nurses took an oath to save lives, not enforce immigration rules. She also urged South Africans to report real concerns properly, through legal government channels, not by creating chaos at hospitals. Her message was simple: we can uphold the law without losing our humanity. As always, all the images used in this video are only for illustration purposes. Now, before we wrap it up, here are the sources you can check out to verify this news. Statements by Gauteng Health MEC Nomantoko Hoko. Department of Health Media Briefings. Coverage from SABC, News 24, and ENCA on recent clinic incidents and government responses. And now, for a quick laugh after all that serious talk. Why did the undocumented thermometer get kicked out of the hospital? Because it couldn't register. One more for the road. What did the nurse say to the xenophobic protester? Take 2 Panados and stop being bitter. Thanks for watching until the end. If you found this news important, give it a like, leave a comment, and don't forget to subscribe so you never miss the truth. See you next time. Stay kind, stay sharp, and stay informed.